Hello, and welcome to SHP Insight. Today's guests are Dr. Sue Feldman and Mohan Thirumalai from our Department of Health Services Administration. They have worked tirelessly since the pandemic began in February to build and scale the GuideSafe and UAB Healthcheck web applications. I chatted with them safely via Zoom earlier about new developments and about the future of these apps. Sue and Mohan, you and a group of your colleagues met to discuss how we could track symptoms of COVID-19 and really to help the university out. Tell me how it all started.
So in February, when the pandemic struck, a faculty from College of Arts and Science reached out to us, that is Sue and myself, about a COVID tracking project. So we launched the helpbeatcovid19.org, which was a symptom tracker and heavily customized to the conditions here in Alabama. And then the tool was then repurposed to become what is now known as Healthcheck. And subsequently, we also developed the GuideSafe exposure notification app. It not only tracks people who get COVID, but also alerts others about potential exposure. Again, this project was a partnership with Apple and Google, and that app has been downloaded by more than 100,000 people until now.
A lot of work that's been done in a little over 10 months, so thanks a lot for that. Sue, there were two big announcements in November. Let's start with the first one. Tell us about the new partnership with MIT.
Healthcheck is a nonprofit organization that has their own exposure notification app, very similar to what we've done with the GuideSafe exposure notification app. The major difference between their exposure notification app and GuideSafe's exposure notification app is the test verification technology. Right here at UAB, Brian Rivers and Rajesh Pillai in UAB IT developed a patent pending technology that is being used in GuideSafe's exposure notification app for test validation that now has been adopted by PathCheck. And so that is our collaboration with them. We are very excited. There's already several states that have shown interest in using our test validation process.
It really impacts a lot of people other than just people at UAB. It impacts people in the state and across the country. The second announcement, we're coming up to a big Thanksgiving holiday. The second announcement impacts travel, which is a major concern for so many of us and all the people around the world. How will the app work to keep people safe on the road?
So this is very exciting and just got implemented last Friday. We onboarded to the national server, Association of Public Health Laboratories server. And so what does that all mean? As people travel outside of Alabama, across the United States, anytime their phone comes in contact with another phone from another state that is also on the national server, those two phones will exchange keys or codes. When somebody later tests positive for COVID-19, you will still get that notification. And so this is a very big development for us because there's already 12 states and Washington, D.C. that are on the national server. And so for us to join them is really a big thing for Alabamians, especially for college students who want to travel home, and they or their parents want to feel like there's an element of security and safety when they're going about their travels.
It's going to make a big impact. Instead of just being a local Alabama notification, it's going to be United States wide. So that's really, really important. Sue, I know you can't get into a lot of the specific details, but what else can you tell me about future applications of GuideSafe?
So we know that vaccines are not going to decrease the spread of COVID-19. It is only vaccinations that will decrease the spread of COVID-19. We're starting to look at how can we integrate the GuideSafe exposure notification technology to include vaccinations? And so we're not there yet, but we're starting to look at it because we know that that's on the horizon, and that's something that we definitely want to be thinking about.
COVID's going to be with us, but it's going to be in a much more manageable form. Mohan, this is a question to you. Where do you think you take this work from here?
The massive amount of infrastructure and technology being built for this project has a great chance to be generalized for any communicably spreadable disease. And so this could be used for flus, any new pandemics. We obviously do not hope for a pandemic, but if there is one more pandemic, it can be used. As with any surveillance or intervention project, compliance or adherence is a major problem. I think we have found a good balance of technology, which is increasing the compliance or adherence rates, and which can be highly replicated. To get more detailed, at UAB, you would have noticed that the frequency of text messages you have received from Healthcheck has been changing. And what we have found is that really controls the compliance rate. Right now, the compliance to Healthcheck is almost nearing 100%. And it has taken a lot of tweaking. And so all of these will be very useful in transferring to other communicable diseases as we move forward.
So the infrastructure, the term that you use, infrastructure that you've built, can really be utilized across many other things in the school and at the university. So thanks for that, Mohan. Sue, I know this is not the only project you're working on. Tell us about some of the other things that you're doing.
Most of the work I do is health informatics for social good. So I try and find areas that benefit people in society, and then develop systems to address those issues. And so a couple of my big projects actually have to do with building data collection systems around opioid and other drug use. These are on a state level, so these are being built for the state of Alabama.
You've done some wonderful things with this, and getting back to your other projects, you're going to do fantastic things there too. Mohan, you've been part of a couple of new grants, or you've been awarded a couple of new grants. Tell me a little bit about those.
Much of my work is focused on scaling health coaching, because health coaching involves a lot of time, a lot of human hours. How can we scale it using automated technologies, but at the same time applicable to rural scenarios? So not everyone has a smartphone. So how can we make health coaching scalable to people without smartphones? That is one of my biggest areas of focus.
Sue and Mohan, I want to thank both of you for taking a little bit of time today. You are making such a tremendous impact, not only at the university, but in Alabama, and now across the states and across the world. So thank you both for taking the time today.
Thank you for the opportunity and all the support you have shown to the project.
Yeah, thank you very much. We couldn't have done it without your support, and you were one of the very early supporters, and we appreciate that.
Turning to SHP News now. Congratulations to Crystal Glasgow in our Nuclear Medicine Technology program. She's been named a Fellow of the Society of Nuclear Medicine and Molecular Imaging Technology section. She's only the third person from UAB to earn this high honor. We've had 2 faculty members earn new board positions. Dr. Brooks Wingo in our Department of Occupational Therapy has been elected as an early career member at large of the American Congress of Rehabilitation Medicine. And Dr. Ted Bertrand, our Assistant Dean for Undergraduate Research, has been voted in as a member of the board of the Alpha Eta Society. Alpha Eta is a national honor society for the allied health students. He will serve a 2-year term. Finally, our Summer Health Professions Education Program, known as SHPEP, has been renewed for another year by the Robert Wood Johnson Foundation. This program is in partnership with the Schools of Dentistry and Medicine and works to strengthen the development of underrepresented students in health professions, and is led by our Dr. Tracy Cinco in the Office of Student Recruitment, Engagement, and Success. Congratulations to all. That's all we have time for today. Thank you for watching. My best wishes to you and your family for a safe and wonderful holiday season.